Cayman's community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Hello, Cayman, and welcome to another episode of Healthcare Today with the HSA. I'm your host, Austin Harris. And my guest today, it is my pleasure to welcome to the Healthcare Today studio, Nurse Annie K. Price. And we will be chatting about the adult and international health clinics, what that means to you, and of course the array of services that are made available to you, the patient of the Health Services Authority. So with that, I would like to say good day and welcome to you, Nurse Annie K. Price.
Good day to you, Austin, and thank you so much for having me here to speak on the services offered by the Public Health Department, services that impact every one of us throughout the Cayman Islands. As you know, public health is the foundation of a healthy, thriving community. Its importance cannot be overstated. Public health focuses on disease prevention, health education, health promotion of healthy lifestyles, emergency preparedness, environmental health and safety, amongst many others. I could go on. However, today we will focus on disease prevention through the expanded program of immunization, also known as EPI program. And there are several immunization services offered through this program, but today we will focus on the adult and international travel health clinics. The other services would be childhood immunizations, school health immunizations for children in our schools, the human papillomavirus clinics offered at the Public Health Department, the COVID-19 and flu vaccine clinics offered in the community and at the district health centers, like I mentioned, the adult immunization clinics and the international travel health clinics. The sexually transmitted infection program also offers certain vaccines to the clients. And we also have the Mantu testing, which is the tuberculosis testing clinics that are held at the public health clinic at the Smith Road Center, Medical Center.
Yes. Well, again, as we have discovered here on Healthcare Today with the HSA, the services that are provided by the HSA are comprehensive, and gone are the days where you have to go overseas or seek specialist care in order to address whatever it is that ails you. And I think, once again, today would be no exception. Nurse Annie K., before we get into the main thrust of our discussion, I think our listeners would like to know a little bit about you and your background and certainly, how long you've been with the HSA. So tell us a little bit about Nurse Annie K. Price.
Well, I don't like talking about myself.
I know who does.
Anyhow, here we go.
It's not bragging if it's the truth, somebody told me.
Right, yes. Well, I am a registered nurse, midwife, and a public health nurse, and a health and wellness coach, as a matter of fact. But I have been working with the Public Health Department since 1991.
Okay.
So I've had 34 years there, and during that 34 years, I've worked in different areas as a midwife initially,
yes.
Community midwife, and since I did my training in public health nursing in 1997, I came back and I've worked in the area of school health for 7 years, and then I transitioned over to child health clinic, and then we are developing the adult and immunization international vaccine clinic into a program.
Okay.
We're in the process of doing that. So that's where I am right now.
That's terrific. Well, I thank you for that. And again, it is a pleasure to be able to host you for today's episode.
Thank you, and it's a pleasure to be here.
Thank you, ma'am. Well, let's just get into it. Tell us, what is the Adult and International Travel Health Clinic, and what services does it provide?
Well, the Adult and International Travel Health Clinic are held at the same time on Mondays, Wednesdays, Thursdays, and Fridays. But they offer different services, immunizations.
Okay.
So if you are an adult living on island, there may be a variety of vaccines that you may require throughout your lifetime. And we will touch on those shortly. If you're traveling, you will have to come to the International Travel Health Clinic and to consult with me so that we can talk about where you're going, what you're going to be doing, what type of accommodation, what your risk factors are according to where you're traveling to. So that's the difference between the two, but they're all both combined into one clinic.
All right. All right. You mentioned the immunization clinic. I'm suspecting that is obviously a key component or part of the Adult and International Health Clinic. What are the services provided by the Adult Immunization Clinic? And again, why is that important?
So the immunizations for adults are crucial to maintain good health, proper health, prevent outbreaks, and protect vulnerable individuals.
Mm-hmm.
And I must say that the Adult Immunization Clinic, although it is called adults, there are times when we have to see children also.
Okay.
But it's a rare occasion because normally the children would complete all of their immunizations by the time they reach the age of 5.
Right.
And the other vaccines that they would have would be the tetanus vaccine due at age 14,
Mm-hmm.
14 to 16. And another vaccine they may have at the schools would be the human papillomavirus
Right.
vaccine. So occasionally we will see some of those students who've slipped through the cracks and who need to be immunized. But predominantly the clinic is for adults who may require a variety of vaccines.
Right. And just speaking casually on the tetanus vaccine itself, that's renewable every 10 years?
10 years, yes, it
All
is.
right.
Every
Yes,
10 years,
yes,
yes.
indeed.
Yeah.
What are some of the more common vaccines recommended for adults?
Well, I'm going to start off by mentioning that the flu vaccine is annually it's offered to
Yes.
adults throughout the Cayman Islands, as mentioned previously in our district health centers, the general practice in Georgetown, and also out into the community in various supermarkets and different locations. Of course, the locations are listed on the website at hsa.ky. We also offer the Tdap vaccine, which is tetanus, diphtheria, and whooping cough.
Mm-hmm.
It's a one-time. It's a booster that's offered to adults every 10 years.
Right.
And it's also offered to all of our students who are going overseas to universities. We offer it to when their parents are expectant parents. Usually the mother will get hers at the clinic, antenatal clinic, but the father sometimes will come and get his at the public health clinic. Grandparents usually turn up for that vaccine as well. The pneumococcal vaccine protects us against pneumonia, and it is offered to adults who are age 65 and over.
Mm-hmm.
However, other persons under the age of 65 can still get the pneumococcal vaccine if they come with a prescription from their doctor.
Okay.
We also offer the shingles vaccine, which helps to protect people age 50 and over from getting shingles. And we'll talk about that in a little while. We'll explain why that's necessary at that time. The shingles vaccine consists of 2 doses, 2 to 6 months apart. We offer the hepatitis B vaccine as an adult vaccine to local persons who may be required. It might be required by their employers. It might be required because of any procedures they may be doing. There are different reasons why adults in the population might want that. Some people are finishing off a course they started a few years back and they want to finish off the course. So that is one that we offer to all of our population. Hepatitis A is also offered to healthcare staff workers. Persons who work with the waterworks and sewage workers will also be offered the hepatitis A as an adult vaccination in the local setting. And the human papillomavirus, as I mentioned, which is now offered to adults over the age of 28, from 28 to 48, and consists of 2 vaccines. Once you're 26 and over, 26 to 48, it consists of 2 vaccines. Under the age of 26, it's 1 vaccine, and we start at age 11
Okay.
to offer that one. So those are the vaccines that we more or less offer. As you know, I mentioned the COVID-19 and the flu vaccine.
Yes, indeed. And that's certainly a comprehensive list.
Yes.
Well, you know, my parents used to say to me, always look for that silver lining in every cloud. And I say that to say that whilst the COVID-19 pandemic was quite the experience, not only for us, but certainly the globe, I think one of the positive takeaways from the COVID-19 pandemic is it reminded us of the importance of vaccinations, which we normally wouldn't think of. As you mentioned, certainly as a child, you get your vaccines up to age 5, and unless you're going for a tetanus once every 10 years, it's not a thought that's part of your regular, practice. But certainly it is as important today as it's ever been.
Well, most people will say to me, if I ask them, have you had your pneumonia vaccine, or have you had your shingles vaccine, or I might even say, have you had your tetanus vaccine? And they'll say, well, I didn't know I needed one.
Quite right.
Which is why I'm here,
Yes.
because we need to really educate the public.
Indeed, indeed. And that's an excellent segue to my next question. Who should consider visiting the adult immunization clinic?
Well, we've mentioned a couple of them already. We've mentioned persons who are expectant fathers and the grandparents on both sides of if there's a newborn baby that they'll be in contact with. We also mentioned a prescription from doctors. But persons who are 65 and older don't need a prescription. They can come to the clinic and we'll just give them the pneumonia vaccine. And persons age 50 and over can have the shingles vaccines. Adults with chronic conditions like diabetes or asthma, heart disease, it's best for them to keep up with their vaccines. It's important for them not to get the shingles and not to get pneumonia, because they all already have a comorbidity and they just don't want to have any more health problems.
Right.
So therefore, they really ought to keep up with their vaccines. Healthcare workers who are seeking employment locally, and anyone else in contact with vulnerable populations will need to come and get their vaccines updated.
Indeed. Thank you for that, Nurse Annie.
Sure.
You mentioned shingles rather specifically, and I wonder, because there's certainly been a thought that lingers, can you explain the link between chickenpox and shingles, and why adults should be aware of that linkage? Because certainly we have seen, I won't call it an outbreak, but we've seen cases of chickenpox in the Cayman Islands in recent years, and certainly shingles is something that many of us are very familiar with.
Mm-hmm. It is here, yes. First of all, I want to just say that persons with an unknown history of chickenpox may need to be tested to confirm prior to their vaccination. Now, why is the vaccination, chickenpox vaccination, offered to our children?
Mm-hmm.
We give it at age 1 year,
Yes.
and then we give it again at age 3 years. And those children are highly, highly unlikely to ever get chickenpox. If you have had chickenpox, as I have had, when I was 27 years old doing my midwifery training, I came down with chickenpox.
Right.
If you've had chickenpox, the virus will never leave your body.
Okay.
After that, it remains in your basal ganglia, just hiding and waiting for the time when your immunity is weakened.
Right.
And then it'll actually come back as shingles.
I see.
So instead of having these spots all over your body, excuse me, instead of having spots all over your body, you may find that you'll have one cluster of all of these vesicles, and it's very painful.
Okay.
It can last from 2 weeks, 2 months, 2 years.
Mm-hmm.
It can repeat itself every year. You may get it every year
Wow.
for 2, 3, 4 years. Where it occurs on the body, it can damage that area.
I see.
So when I was in London, I nursed a 19-year-old guy with shingles right over one of his eyes.
Oh, my.
And so he had to be admitted so that his eye could be treated every day to
Right.
prevent him from losing his vision. So you will have persons who complain of pain in the area forever afterwards, or tingling or numbness. So it damages the nerve. So shingles is not nice. It's really not a nice thing. And everybody tells me who've had it, or persons who have had friends with it, are telling me how very bad it is. So it's important that they come and get that shingles vaccine. They can come and have the test. And persons may be required prior to going to dental clinic, or veterinary students. Other students may be tested with blood testing. So that it's important that we get the test if we don't know if we've had chickenpox or not, and get the chickenpox vaccine if we're not immune.
Right.
Get the
Indeed.
shingles vaccine if you've had the chickenpox.
Indeed. And I thank you for making that broad point, because it's a bit of a myth now that I hear you talk. I mean, the general pervasive thought is, well, once you get chickenpox, it's a good thing because you'll never get it again. But the truth, in fact, is you mightn't get chickenpox again, but you'll get something camouflaged or something else that is related to that chickenpox,
which is worse
than chickenpox,
and
that will reoccur indeed. Again, if you've written off the notion that vaccines are not important, they have no value in this world today, well, hopefully at the end of our episode today, you will take a different view on that, and certainly you will schedule your appointment at the Adult and International Health Clinic. We do need to pause and take a short break, but there still remains a lot more healthcare today with the HSA and our guest, Nurse Annie K. Price, as we discuss and continue to discuss the Adult and International Health Clinics and why the services provided therein are important to you. So don't change that dial, but instead stay right where you are. We will be right back with more Healthcare Today with the HSA, brought to you exclusively by Bobo FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
And welcome back, Cayman, to Healthcare Today with the HSA and, of course, our guest, Nurse Annie K. Price of the Adult and International Health Clinics, talking about everything you need to know about why vaccinations and immunizations are important to you, not just when perhaps a pandemic may be looming, but certainly whenever you are traveling, which we're going to talk about what sort of immunizations and vaccines one might want to consider when traveling abroad, as well as what you need in day-to-day life. Nurse Annie K., we were chatting about adult immunizations and the various vaccines for adults prior to the break. Talk to us about blood testing for immunity and why that is important as part of the overall vaccination process.
Yes, certainly. There are persons who may not know what their immunization status is. There's many people who don't have a record anymore of their immunizations and may want to know or may need to know what those are, what they're covered for, what antibodies are in their bloodstreams against what diseases. And they may need a blood test called a titer. So the titers, when we do the blood test for titers, it shows whether the person has been immunized or it shows whether the person has come in contact with the disease, let's say, for example, chickenpox or hepatitis B. I often test people for hepatitis B because they may want to know what their status is prior to being vaccinated. So persons who may be required by a visa applicants may be required. Other persons might be people who are applying to work in the BVI or the Turks and Caicos Islands. They are very strict with what the situation is, immunization records of persons who have been employed there. And other persons might be going for some sort of medical procedure and need to know what their titers are. Some people just want to know, curious as to what vaccinations they need, and will update. So we do the blood test, and about 2 to 3 weeks later, they come back, and then we'll give them the results, and then we can decide which vaccines they need and which ones they don't need.
Okay, excellent. Yeah. Now, during the COVID pandemic, again, the immigration and customs in particular, when traveling, were very strict about knowing your health status. So I wonder, why is it important for travelers, persons who have a vacation or a business trip, or they're taking their son or daughter off to university, why is it important for travelers to visit the health clinic before going abroad?
Well, visiting a travel health clinic before going abroad is crucial because it helps travelers prepare for potential health risk in the country of destination. Some countries have diseases that are not common in other parts of the world. So there may be diseases in, say, parts of Africa or parts of Southeast Asia or South America, Central America, that we are not familiar with. And so the travelers need to be educated. They need to know what their risk factors are. And the risk factors would depend on how long they're going to be there, what their activities are going to include, and what the destination, of course, the activities, and also the type of accommodation. Because some persons may be engaging in very risky activities. So we need to assess. For example, we have two ladies who've just left Cayman recently to climb Kilimanjaro.
Oh, wow.
So
yeah.
there's a lot of preparation work involved in for those ladies to be prepared and to have everything with them and know exactly what their risk factors are. So they came in and had all their vaccines that they needed. And plus we give a lot of health advice as well. Other
Right.
than the vaccination, we give a lot of health information to them.
Indeed. Now, the follow-up question you may have just touched on briefly, but I'll ask again specifically. What specific services are provided for international travelers when they visit the
Yes,
the
so we
clinic?
do that consultation prior to travel, and we also we administer the vaccines, and then we also discuss certain risk factors with them and how they can avoid those risk factors. We also send them our travel tips. We email the travel tips. I go over the travel tips with them, so that they're prepared and they're equipped, they're armed, they're really ready for that travel, and they know what to expect, and they know what they need to do. For example, one of the things they might require is malaria tablets.
Right.
So to prevent them from getting malaria. So I go through that and I tell them the importance of having taking those malaria tablets 2 days before they arrive, every day they're there, and 7 days after they've left. So those are some of the things that we have to go through with them.
All right. And again, it's almost like you're reading my mind in terms of where we're headed to next. Talk to us about specific regions. Are there regions around this world that travelers should otherwise be concerned about or particularly cautious? I know, just off the top of my head, we've got a bird flu epidemic. Whilst there are cases in the U.S., it hasn't been human-to-human transmission, but it does exist elsewhere in the globe. You talked about malaria. There are mosquito-borne illnesses
Yes.
that are common in South and Central America.
Yes.
Talk to us, are there any key regions that persons who might have travel plans or considering traveling, that they might want to be a little extra cautious and or certainly visit the adult and international health clinic?
Yes, dengue fever is a real concern, and there are large numbers of people developing dengue fever in countries that are in this region. And so it's important that they understand the importance of bite prevention precautions. And we're going to go through that shortly.
Yes.
There's also yellow fever in this region as well as Central Africa. So it's important that the persons traveling to South America know that they need to have the yellow fever vaccine. And each person that's vaccinated is given a yellow fever booklet.
Okay.
And this booklet is presented at the airports on arrival, on departure. And some countries may not ask for it, but other countries will ask for it. And it's important that they have it in case they're asked for it. Now, if you opt to go to Panama City, where there's no malaria, no yellow fever, where there's no yellow fever, that's fine.
Right.
But you can only travel on certain airlines. That's Cayman Airways and American Airlines. You cannot travel on an internal flight without the yellow fever. They will stop you. They will turn you away.
Oh, wow.
You cannot go to Honduras afterwards. You cannot go to Nicaragua afterwards, Jamaica, Costa Rica, or South Africa.
Wow.
Those countries will turn you away.
Okay.
Or in South Africa, they will actually give you the yellow fever vaccine on the spot.
All right.
So there are certain countries that are very strict. So I always say to them, it's your choice whether you have it or not. But if you don't have it, this is what could happen. And in the future, it'll impact your travel because you lose your ticket. You can lose your opportunity to visit the country you wanted to visit. So it's important that they have that vaccine. There's the Oropouchi virus in this region as well. And there's there are other conditions, other diseases that are actually popping up here and there. So we have a website that we go to consult with so that we know what the problem is in that locality. Pardon me.
Right.
So that we know what the problem is in the locality, where the person, what their risk factors are, and we can actually discuss it with them and how to avoid getting the disease that is there. Sometimes the disease that we're referring to sometimes the disease we're referring to might be like cholera.
Right.
So that might be confined to a village setting or to a setting where there's a local population, and the cholera vaccine wouldn't be offered to anyone unless they were going to attend to those persons with cholera.
Right.
So some vaccines are not necessary. There may be a wild polio circulating. They may need the polio vaccine depending on their activities.
Okay.
If you're going to be mingling with the local population,
Yeah.
you're going to be going to villages, you're going to do missionary work, you may need the polio vaccine.
Yes. Yes.
So there are circulating at any one time. There's Marburg, might have Marburg disease. There's West Nile sometimes.
Right.
Sometimes there's Zika. We hear about Zika,
Yes.
chikungunya.
Sure.
But we go through and make sure that everyone knows how to protect themselves from vector-borne diseases. That's a mosquito,
Yes.
a fly, or an insect.
Okay.
Those three are the vectors, okay? We make sure that they know how to protect themselves from vector-borne diseases. And we have been very successful, I would say, at preventing those things from coming into this island.
Sure.
Simply because I really emphasize to our travelers that's very important for them to take these precautions.
No, absolutely. And we're grateful, certainly, to the HSA protecting you, not only here at home, but protecting you in your travels wherever you may go to keep you safe. But of course, likewise, obviously, ever cognizant that you will return and to keep the rest of the broader population safe upon your return. We touched on a number of different viruses and illnesses and that you can be vaccinated for. But are there any recent outbreaks anywhere in the world that we should be concerned about and obviously travelers should be aware of?
Well, I think that I mentioned two of them, the Oropuchi virus, and I mentioned also malaria, yellow fever, and I mentioned the dengue fever. Sometimes there'll be an outbreak of yellow fever occasionally.
Right.
But right now I would have to look specifically in the area the person's traveling to see if there's been any recent outbreaks.
Right.
Okay. Let me give you an example of what might be going on in a country that people are just not aware of.
Yes.
For example, if you go to Costa Rica, Costa Rica has the vampire bat there.
Right. Yes. Yes.
And the vampire bat transmits rabies.
Okay.
The vampire bats don't come out during the day. They only come out at night.
Yeah.
If you go into a cave, there's vampire bats up. They're not going to bother you at all. They're not going to trouble you. However, pardon me.
That's all right.
In Costa Rica, there's been displacement of the vampire bats because of deforestation.
Yes.
The vampire bats then have come out at night, and due to the fact that they probably are disorientated, they have been actually landing on the backs of cows. So there's bovine rabies
Right.
in Costa Rica.
I see.
And the Costa Rican authorities are dealing with that. They're working on it because they know it's a problem there. But that does not affect adults, human beings.
Right.
They haven't had any human rabies incidents for the last 30 years. They've had 3.
Okay.
Yeah,
Okay. Well, that's
3, which is very,
encouraging.
very much. So it shows that there was something specific that went on for those 3. Possibly they might have been travelers who came into the country as well with it already.
Right.
So we know that Costa Rica is a safe country from rabies. So that's the sort of research that we do to ensure that the person who's going to a location knows exactly what their risk factors are.
All right. Excellent. Thank you for that. And again, another comprehensive response and why it is important to visit the adult and international health clinics, because wherever you're going in this world, you might find something specific to that location that you need to be aware of, and in worst case scenario, you need to be immunized for. Just very quickly before we take the next break, since we're on the mosquito-borne vector subject, I know that there have been some misunderstandings or oftentimes queries as it relates to the yellow fever vaccine in particular, and perhaps the difference between it and some of the other mosquito-borne vaccines that are available. Maybe you can tell us a little bit about what makes the yellow fever vaccine so unique, and what are some of the questions that oftentimes you get surrounding that vaccine?
Well, one of the things I would like to say about the yellow fever vaccine is that it is not recommended for people over the age 60 and over.
Okay.
Because it's associated with some serious neurological conditions. However, if the risk to the person is much higher than the risk of them developing the neurological problems, then it may be something that might be considered.
Right.
Might be considered only if their risk is much higher.
Okay.
if they don't have the vaccine, the yellow fever vaccine. Another area I'd like to mention is that in Panama, there's a canal. The canal divides the yellow fever of Panama. East of the Panama Canal, there is yellow fever. West of the Panama Canal, there is not any yellow fever. Most people go west of the Panama Canal. But again, as I mentioned before, if you're going to go to Panama, be sure, if you don't have your yellow fever vaccine, be sure that you're not going to be traveling to a country afterwards that has restrictions,
Right.
like the countries I mentioned. Also, if you're traveling on internal airlines, you would run into problems after going to Panama. I also wanted to mention that in Africa, yellow fever is being eradicated in several countries have already eradicated it, and several countries are part the way through. So the risk of yellow fever has dropped in some countries.
Okay.
And the same rule applies. If you arrive there and you haven't had your yellow fever vaccine, they haven't eradicated it completely. They may accept you in because of your location, where you're going to be staying in a 4-star hotel. You're not going to be at risk. However, if you then try to fly to South Africa, you may run into problems.
Indeed.
Or if you go to Jamaica and they see that you've been to one of those African countries, you may run into problems.
Indeed.
But it's important for countries like Kenya that you really do have that yellow fever vaccine. Or if you're 16 over, you can get a certificate of exemption from us.
All right. Thank you so much for that, Nurse Annie K. Price. Once again, we do need to pause and take another short commercial break, but there still remains a lot more healthcare today with the HSA and our guests, Nurse Annie K. Price, and of course the Adult International Health Clinics in which she is responsible for. When we come back, we've been talking about the need for vaccination both here at home as well as particularly when traveling. We've been talking about knowing specifically where you're going because there are region-specific illnesses that require specific vaccinations. When we come back, we're going to talk a little bit about prevention. I say prevention is oftentimes better than the cure. Well, we're going to find out when Healthcare Today with the HSA returns, brought to you exclusively by Bobo FM.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
And welcome back, Cayman, to Healthcare Today with the HSA and our guest, Nurse Annie K. Price, as we continue our conversation here on the Adult and International Health Clinics. Everything you wanted to know about vaccinations but were afraid to ask. And that means vaccinations not only here at home, but certainly when you are traveling. It's not just, as we are discovering, it's not just during the COVID-19 pandemic that vaccinations and being aware of what you have and what is up to date during the COVID-19 vaccine, but whether it is a result after the fact or otherwise, but vaccinations are very important, not only protecting your life, but that of your family, those around you, and particularly when you return back to Cayman, that you're also protecting the wider population. Nurse Annie K., we were chatting prior to the break about travel, health, and vaccinations, what people should be aware of, and what protection they should have before they go on these visits. And I just wanted to wrap up that aspect of the conversation to ask the final question. Are there any other vaccines that we have not yet mentioned that are required before travel for persons who might be considering travel? I know your answer was very comprehensive, but just to make sure we cover all of our bases.
Yes, there are, Austin. Thank you for asking. Because we mentioned yellow fever, we mentioned malaria, but there are other vaccines that we have to look at very closely. And that is, we look at the risk factor of persons traveling related to typhoid. Now, I don't give it out freely, and I don't give it to everyone who's traveling anywhere. I just look at the risk factors. So if a person is camping, hiking, river rafting, mountain climbing, low budget, roughing it, then we might want to consider whether or not they have a risk factor for developing typhoid. They're outdoors. They may be using contaminated water to cook with or to even drink, and their filtration system might not be working as well. And so typhoid could be a risk factor. And so we, once we've done the assessment, then we advise accordingly. Sometimes I'll even go online and see how many cases, what's the incidence of typhoid in the country that person's going to. I want to encourage the public to do the same thing,
Yes.
because it's easy to find out how many cases of typhoid in the last year, 2, 3, 4, 5 years. The other vaccines that we offer is the hepatitis A is a very important vaccine for our travelers to ensure that they get before they travel. And we're talking about countries like Europe, Africa, Southeast Asia, South America, Central America, all of those countries we need to really consider carefully before we travel to them that we've had our hepatitis A vaccine. One vaccine covers you for a full year. So you can travel on the one vaccine and you'll be covered. It'll prevent you from getting hepatitis A. And hepatitis A, we just don't know when we're going to come in contact. It is transmitted through food and water,
Yes.
whereas hepatitis B is transmitted through blood and body fluids. So we also offer the hepatitis B. And the reason being is that if a person's going to a remote destination, if they were to meet with an accident and required a blood transfusion, there's no guarantee that in that remote location the blood has been properly screened, and so they are at risk of developing hepatitis B. Persons who have tattooing, persons who have any sort of body piercings in foreign countries, persons who mingle with the local population may also be at risk from hepatitis B. So we look at their risk factors and advise accordingly. The tetanus vaccine, we always advise everyone to be up to date with their tetanus vaccine, because you don't really want to be in a foreign country and have to go seeking medical aid to help you find a tetanus vaccine or go to an accident emergency place. So you might as well travel having been vaccinated up to date with your tetanus. Every 10 years, of course,
Yes.
we need to take our tetanus vaccines. The polio I mentioned previously, and the rabies we also mentioned. There are certain persons that I would specifically offer rabies to. And those are persons who are going to work, say, in Southeast Asia with the pandas, or in Africa with animals, animal sanctuaries. Veterinary students all have to have rabies. People who might have a risk factor. If you're in a country with rabies for only 2 weeks, you're not going to run a risk. You're staying in a 4-star hotel and you're just going out to the usual tourist sites. You're
Right.
not at risk. However, anywhere in the world, anyone can be bitten by a dog or a cat, suddenly scratched by a cat, suddenly, unexpectedly.
Sure.
And so we give very specific instructions what to do, because the post-bite treatment is very effective.
I see.
So we wash with soap and water right away. We seek medical attention and start the rabies series. And we can finish it off in Cayman when they come home.
Okay.
So we don't necessarily give it to everyone. We only give it to persons who have that risk factor. We also offer the meningococcal vaccines, 2 of them, to all of our students traveling to the US, Canada, the UK. And we offer the chickenpox vaccines, as I mentioned earlier, also to people who are preparing for a visa application or waiting for their appointment. They may not know what their chickenpox situation titers are. So we may not have time to even do those titers. So we may just offer them the chickenpox vaccine.
Yes.
However, I prefer to do the blood testing, which is why we want them to come early for their appointments. Book at least 2 to 3 months in advance.
Wow.
Because our clinics are booked up for 6 weeks.
Wow.
So we need them to book 2 to 3 months in advance. So if we need to test the blood, we can do that. Some people may even require for us to order a vaccine. Last year, a gentleman did just that. He was moving to Japan, and he wanted the Japanese encephalitis vaccine that would prevent him from getting Japanese encephalitis. And so we had to order the 2 for him, and we made sure he had them before he left.
Indeed.
Because he had some risk factors there. And right now we also have a request for some other unusual vaccines that we don't carry. There is a vaccine for dengue fever for persons who've had dengue fever in the past.
Okay.
There is a vaccine, but we don't have it in the Cayman Islands. And the reason why we don't have it is because we have the vector. We have the mosquito that carries it, but we don't have any cases here. We occasionally do get 1 or 2 or 3 cases. We treat the person, treat the environment, the MRCOs involved, and to prevent it from being
happening.
spread.
Yes,
from
indeed.
spreading. So, but there is a vaccine for dengue. If you've had it previously, The second time you get dengue fever is called dengue hemorrhagic fever and can be fatal.
All right.
So right now we have someone who's making that inquiry, and so we will be seeing if we can source the vaccine for him, and how many, and how much, and how quickly we can get it here so that we can immunize him. Otherwise, we may actually advise him to seek it in another country, look for the vaccine in another country, which is he's quite prepared to do as well.
Right.
So those are the vaccines, more or less, that we offer for international travel.
I see. Now, you just mentioned, because my follow-up question would have been, how far in advance would you recommend travelers specifically book their appointments? You just said 2 or 3 months, which was a bit of a shocker to me. But what other question that popped into my mind, because you mentioned a number of different vaccinations based on region. Some regions may require multiple vaccinations. Can these vaccines, for example, if you're traveling to a country where the risk is higher than you would in other, so therefore you're taking more than one vaccine, can these vaccines be taken concurrently, one right after the next, or is there a delay, a day, a week, a month in between vaccinations, and hence the reason why it's important to schedule your appointment as far in advance as possible?
Well, Austin, that's a very good question. Because if I'm giving live vaccines, if I give 2 live vaccines, I either have to give it on the same day or schedule it 4 weeks apart. We can't give live vaccines close together.
Okay.
If I'm giving vaccines to a person whose timing is very short, then I am at liberty to administer up to 8 antigens in one day. Now, that depends on the spacing on the arms. We'll have to space it 2 inches apart. But we can give multiple vaccines. However, there is a vaccine that I don't give any other vaccine with anymore at all, and that's the shingles vaccine. That's for the adults. We don't give that one together with any of the other vaccines, but most of the other vaccines can be given at the same sitting. I remember a gentleman from one of the accountant firms came in. He said, "Give me everything you've got. I'm going to be gone round the world for 6 months."
Wow.
He said, "I don't want to risk getting anything.
Yes.
So give me whatever you have to give me."
Right.
And I was able to, but we don't go over 8 antigens. We can do.
Right.
We can do. Your body can handle over 8 antigens. But we have a policy that we don't go over 8 antigens in one day. So I space them out.
Fair
Now,
enough.
if I'm not giving you a live vaccine, I can actually see you in a week or 2. I tend to like to leave it for 14 days because by then your antibody levels are pretty much where they should be.
Yes.
So I will say, come back in 2 weeks. Let's give you another 2 or 3 or whatever. If they need multiple vaccines. So that's a very good question.
Indeed. Thank you so much for that. And thank you for, once again, the very comprehensive response. I like that. Gentleman walks in, give me the works. I want it all. Yes. Speaking of travelers again, and you just given a real world example, but let's talk about experiences that you had directly with travelers and how can people reduce their risks? Any travel tips that you might otherwise be willing to offer up today to our listening audience?
Well, there's some travel tips that we do recommend to persons. We actually email them to our clients so that they can have the opportunity to read through. And those travel tips would include food and water hygiene, bite prevention precautions, safety precautions, travel health insurance, which is very important, information on potential health risk in the country they're going to. We always make sure that they have the proper documentation with regards to the yellow fever vaccine. That's the only vaccine that you would be required when you're traveling to produce documentation on, unless you're a person that's going overseas to work in a country that requires that. And also the students require documentation. And so we have a very nice schedule that we can complete for them, a list of all the vaccines to send with them to their universities where they're going to. And yes, we also give them a list of what first aid items they could purchase to put in a small kit, take with them. And we also give them the do's and the don'ts.
Yes.
What to take with you. We give them a long list. They can choose from that list what they think is appropriate for their trip. But it's just a guideline. It's not to tell them what to take, but it's just a guideline. So what information for travelers is very, very important, that they read it and they understand what their risk factors are and that they take the precautions. And some of the things that have happened to our clients who haven't followed the instructions, because that's
Yes.
the first question I ask them when they come back.
Hmm.
I ask them the question, did you have any problems while you were overseas? Did you have any, was everything good? Did you have any problems? And several have told me they've had gastrointestinal issues because they ignored my advice to not eat food from roadside vendors.
When will they learn to listen to the good nurse?
I know. And the roadside vendors' food is so delicious, and it looks so. And when you're hungry, it's very hard to resist it.
And as part of every vacation, you're mingling with the locals.
Right,
But,
you want to
when
eat
in
the local
Rome,
food,
one
but-
must do with the Romans.
Yes, but I have to warn you, if you were to see where the food is stored and how it's handled, you would
Yes.
not touch it. So I
Yes.
say to them, get your camera out, do a little video recording, see how they make it, go home and do it yourself. Then I've seen a photo of some travelers on the edge of Iguazu Falls. You know Iguazu Falls? It's in South America. There's pools where in fact, I think I've seen the same thing in Canada with the falls there, Niagara Falls, and there's another falls as well. And there's pools of water that people love to go and swim in.
Sure.
And they're on the edge of the drop down, and it's a very dangerous thing because you don't know when a lot of water is going to come and sweep you over the edge. So people do things that can really put them at risk.
Right.
We also had a client who came back and told us that he had chartered a Cessna plane and flown over parts of Africa, I think it was, Southeast Asia, and the plane had crash landed. Luckily, he survived it.
Wow. There's
Yes.
a travel story.
Yes,
You don't
yes,
hear every day.
Yes. And we had stories of persons being bitten by the tsetse fly in Masai Mara, I believe. And excuse me, the tsetse fly causes sleeping sickness,
Okay.
and that's really basically being unconscious. And there was kidney failure, and then they had to be transferred to an intensive care unit in another country where they both recovered. Thank God for that. But
Right.
you can imagine it was really a very a time that the family was very concerned, very worried about them. But they survived, thank goodness. Also, myself, driving through the mountain pass in Costa Rica after dark was a nightmare
Right.
because the clouds come down and the drivers in Costa Rica don't slow down.
Right.
The clouds come down, the drivers continue driving like crazy, and so you're driving on the edge of the mountain.
Right.
So that I always warn people about that. There was a young Canadian lady who went to Greece for the summer. She was riding her moped, was knocked off the moped, ended up in intensive care. Her parents had to fly to Greece from Canada and had to mortgage their house to pay for her health care,
Wow.
their ambulance, and for her health care for her to recover. So those are some of the stories that we've heard that shows you how risky travel can be if persons are not aware,
Indeed.
which is another reason why they should be coming to get their
Indeed.
travel
And certainly
advice.
using that last story as an example, that also highlights the importance of travel health insurance, which you also touched on. Well, we've come to the tail end, almost the end of our discussion. I just have one final question, which comes in two parts for you, Nurse Anike, and that is the all-important question I think is on everyone's mind now, having learnt what they have learnt and take away from today's conversation, and that is how can someone access the adult immunization clinic? And attached to that question, what are the costs, or are there costs associated with attending the clinic?
Yes, for most of the clients, there is a cost associated with attending the clinics. However, we would advise that the traveler check with their insurance company before coming. All students are free. They get their vaccines for university, free. All children are free, have free vaccines. And we're also offering free shingles vaccines to those persons who are retired or over the age of 65 and have no health insurance. We will offer them the shingles vaccine free.
Okay.
But yes, they do attract some costs.
costs.
Yes,
All right.
and the tetanus vaccine is also free.
All
for
right.
everyone. To
Okay.
everyone, yeah.
All right.
And the other the other part of that question.
How to access the clinic? How do
Oh,
persons,
yes, of course, yes.
schedule appointments
Yes, of course,
and
yes.
move forward?
Yes, well, we have a phone number that's someone who will answer the phone. Our attendant is Oscar.
Mm-hmm.
So anyone can call 244-2648 for an appointment, to schedule an appointment to come to the travel clinic or to come to the adult immunization clinic.
That was 244-2648?
48, yes,
Okay.
yes, yeah.
Excellent. Well, Nurse Annie Kay, I want to thank you for being our guest today. You have provided a wealth of information that I dare say either wasn't top of mind to those tuning in today, or perhaps many were not even aware of. I'm grateful for you coming in and sharing this treasure trove of information for us. But above all, we're certainly grateful to the HSA for clearly thinking of it all and adding the adult and international health clinics as part of their regular services. An opportunity for some brief closing remarks.
Yes. One thing I left out that I must mention to you is that the persons who are traveling to countries where there are vector-borne diseases, such as mentioned before, would be advised to get a mosquito repellent for their clothes. And Repel is the one that comes to mind. It's available at Kirk Supermarket. Jungle Formula, which contains 40% DEET.
Mm-hmm.
It must have 30 to 50% DEET. Preferably 50% DEET. Jungle Formula is the one at Care Pharmacy and other pharmacies too. And Ultrathon from ValueMed Pharmacy is available. Those will protect them from getting many of the vector-borne diseases. So those are for the skin, and the Repel is for the clothes. So it's very important that they get these repellents to take with them. Now, I want to say that in addition to booking early, it's important that they also heed the advice when they come to the clinic. It's important that they come in a timely fashion, 2 to 3 months, like I mentioned, even longer. Some people are coming longer than that. So they can really plan their itinerary. They can ensure that they have everything in place before they travel. And call in the clinic, make the appointment, and don't be afraid to come in and talk with us.
Indeed. Nurse Annie K. Price, most grateful for your time today. Thank you for joining us. And that's all the time we have for this episode of Healthcare Today with the HSA. But certainly the adult and international health clinics, to schedule your appointment, call 244-2648. Or, of course, you can find out more information about this service and all other services of the HSA by logging onto their website, hsa.ky.
Having us.
Absolute pleasure having you as our guest in studios, and certainly to our listeners, to you for once again tuning in to learn more about the services provided by your Health Services Authority. I'm your host, Austin Harris, reminding you to tune in every Friday and Saturday at 1 p.m. for your Healthcare Today with the HSA, brought to you exclusively by Bobo FM.